this program is funded by the National Center for Minority Health and Health Disparities, which is part of the National Institutes of Health. Funds undergraduate and graduate students to participate in international research experiences, which are primarily organized over the summer in a joint program between UTEP and several international institutions. So our students go participate in a 6-week experience on our campus to prepare them for these experiences, and then they participate in a 6-week mentored international research experience at one of our partner institutions in 3 different countries. Well, the UTEP students, one, they get to experience research in a real-world setting, and in a global setting in particular. And so they're exposed to not only the research issues, which might be the same research issues that they would be using or facing in this region, but they also get to experience the influence of the international culture on health, which of course between different customs, diet, the places and that people live, I mean, all of those things tend to predict particular health issues that may be of importance and cause disparities for different populations.
I went to Ecuador and it was an awesome learning experience. Coming from a science background, I did a research project that was mainly social work. So I definitely learned a lot about the different career options that I have, and also I got out of my comfort zone and learned about different aspects in the healthcare system and other things such as that.
I had a 6-week stay in Costa Rica for an investigation with the MHIRT program, and it was an experience. It was a breathtaking experience because not only did I learn about the culture, but I learned about investigation and the research world.
To educate and prepare a new generation of researchers who come from underrepresented groups to enter the research workforce. And it doesn't necessarily mean that they just have to be researchers, but they might be entering a health profession and doing research in conjunction with their clinical practice or conjunction with an academic appointment that they might have, so that we are really looking at how can we best position our students who are primarily from Hispanic and Mexican American backgrounds to take the leadership roles in the future of the health disparities researchers in this country.
My research is looking for social determinants in environmental health, and we were looking at 2 different districts over there. One was a rural and one was an urban area, so that kind of also distinguishes what was there for health disparities. And what we looked was just trying to identify what was the frequency and what was prevalent there that could have kind of had an effect in their health, but we was couldn't quite determine yet.
And I worked with testing different samples of water from a potable water treatment plant, and we tested to see if there was any presence of violence factors after each step of purification.
Besides taking the experience of doing international research, I'm taking the experience of a better student, of a better future social worker, knowing that there's other cultures and that we all have to be aware of that, and that's hopefully one day going to make a better world.
Well, we actually do have some outcome data because the students who first participated in the program in the first years of the program have now completed their professional education and are entering the workforce as physicians, nurses, clinical laboratory workers. We have a couple of people who are actually working full-time as researchers, and they are seeing things in I think through a different lens than they would have had they only had an experience here in El Paso.
It emphasized my love for nursing and my love for traveling. So now what I want to do is put those 2 together, and I think that'll lead to a happy road.
At the time I've been considering a job in research. So it's kind of opened up that door for me now that I have some experience with that, and I am considering maybe going into the research aspect of pharmacy, so I'm still trying to decide.
Before, I thought that research was like a boring field and you just did a bunch of paperwork, but now I realize that it's it's like the iceberg of everything. Like you really need to know, you really need to do your research and everything in order for us to advance in medicine, how the way we treat people, and other things like that.
That it is a great experience, that it's a life-changing opportunity, that when you come back a different person.